Okay, so for my topic, I picked vitiligo, and there's a couple of reasons that I picked vitiligo. And the first reason that I picked vitiligo is that not a lot of people know what it is. And so I'm always wanting to get the word out there more and just help to educate people, I guess, about all kinds of disorders that are out there. And of course, the second reason why I'm so passionate about it is that my son, Caden, has it. He was diagnosed about 3, 4 years ago with vitiligo, so I'm always looking for more research, always looking for more information about it, and just different aspects of the disease itself. So, what is vitiligo? Many doctors feel that vitiligo is an autoimmune disorder, and some don't necessarily agree with that statement. But what vitiligo is, it's basically a disorder that causes white patches or depigmented skin to develop when the cells that produce melanin are destroyed. And some contributing factors possibly could be emotional distress, sunburn, or pre-existing autoimmune disorder such as lupus or thyroid disease. However, these are not considered causative of the disease. It's interesting though when I think about sunburn because when my son first got his first white patch, which was right on the middle of his neck, it was right after he got burnt for, I want to say, the first time in his life. We've always been very careful to put sunscreen on him, and he got a pretty bad sunburn. I just hadn't applied it ever so many hours like I was supposed to, and I noticed that patch. The doctor just said maybe it was more of a trigger to developing the vitiligo and not a cause. I, of course, thought it was a cause at the time. The primary symptom of vitiligo is a loss of pigment in the skin, leading to development of widespread, irregular shaped white patches. The white patches can be more evident in darker skinned races, so they have a harder time concealing it than Caucasian or lighter skinned races. They may also have more of social anxiety that comes along with it because it is more evident in their race than it is in someone who is white. It's a lot easier to conceal or use just regular cosmetics. The areas most commonly affected are areas exposed to the sun, body folds, such as your armpit, your groin areas, areas around moles, and areas of previous injury to skin. So this disease or disorder can develop rapidly or slowly, and there may be periods of times when there's no growth at all of the depigmented skin, followed by rapid growth of patches. All right, so looking at treatment and therapy, since there isn't really a cause of the disease, we know there is no cure for the disease. Most people go see a dermatologist, which, as you guys know, is a doctor that specializes in diseases of the skin to help them with treatment for vitiligo. So the goal of the treatment is to stop future depigmentation of the skin and to restore color to the skin. There are several different types of treatments. The first treatment I'm going to talk about is therapeutic cosmetics. That's going to be like your over-the-counter things you can get at drugstores. Makeup a lot of times can conceal the patches. Sometimes people will buy the sunless tanners so that they can get all their skin to kind of blend into one color. Of course, that's going to be a lot easier for people who are from a race of Caucasian because there's the depigmented skin isn't so drastic from the non-depigmented skin. The first initial step that most doctors attempt to use is prescription steroid creams, and they actually have some new creams out that are non-steroidal anti-inflammatory creams that can help people. And these are one of the safest types of treatment with the least amount of side effects. The next one is PUVA, and this one is successful in over half. However, it can take 2 to 3 months to see any type of an effect. This has to be given in office. It's an oral medication that they take 2 to 3 times a week, and it does have to be received in office. And back to the prescription steroid creams that I forgot to mention, is that can take up to 6 months to see any type of treatment for that. Porcelain treatment, this is where they take the application of a very dilute solution of the drug and directly apply it to the person's depigmented skin, and then follow that, they expose it to direct sunlight. However, this treatment can have some side effects, and one of those is that it makes the individual susceptible to severe burns and blisters following too much sun exposure. Lasers is another option, and this has been shown to promote repigmentation in the skin. And basically they take a narrow band of UV lights and just kind of show it on the skin. Surgical treatment, that can be like skin grafts, but a side effect of that is that removing skin from healthy or from the non-depigmented skin and putting it on the depigmented skin can actually cause scarring. And so it's kind of, can kind of still scar that area. So it's not always as successful as people want it to be. Another option is tattoos. So people can actually get tattoos that match the color of their skin. Of course, they can get any tattoo they want, but a lot of people will just get a tattoo that's the same color of their skin to help their skin blend in. I thought that was just interesting and so available, but something I never even thought of. And then the last one I want to mention is sunscreen. Sunscreen is actually very important for 2 reasons. One reason is that sunscreen, of course, can help you from not tanning and not developing the color in your skin, so helping all of your skin blend together and staying as light as possible. Now, this is going to be also more helpful in people who have the lighter skinned race than the darker skinned races, and that of course is because they can tend to stay whiter and lighter and help match the skin. But sunscreen is also very important because because people who have vitiligo are actually higher risk to melanoma and skin cancer, and so it's important that they protect their skin at all times. So I talked a little bit about how it can take 6 months, 2 to 3 months for any type of treatment to see any effect whatsoever. And that's really important to remember because it's really hard for individuals to adhere to medical treatment for that reason. And a lot of that has to do with the fact that results can be so slow. And so they will stop treatment thinking it's not going to work, or they'll try to skip to another one or skip to another doctor because they don't think this doctor is successful. And so that can cause a lot of problems in the treatment of vitiligo. But one research that I did read about reported that individuals who had faith in their doctors and had great family support were more likely to adhere to their treatment than those who did not. Okay, so when we look at the psychological aspect of vitiligo, I'm sure that as I've talked about some of the problems that occur with vitiligo, you can see where there can be some psychological aspects. And one article that I read was written by Matthew Sullivan, and this one's really interesting, and I'll get into that. So first off, some of the things he just found as he was researching it and asking people questions is that 2/3 of them felt embarrassed of their disease, and more than half feel socially anxious, ill at ease, and unable to mingle with members of the opposite sex. Some mention that it can interfere with their sex life. They feel ugly in front of others, and they feel self-conscious about the ways they need to hide their depigmented skin. And most of them dread summer due to the fact that it exposes more skin, more of their depigmented skin, and it's not as easy to hide it under clothes and such. In his study, 59% of the patients reported an incident in the past 3 weeks where they actually felt someone made them feel bad about their vitiligo. 75% reported that strangers will ask what is wrong with them in public. 13% reported job discrimination, and 40% showed signs of depression. Something to note on the signs of depression is that um, many people, they felt that many people would take like a passive stance towards their vitiligo or do no treatment at all. And so they thought maybe they had signs of depression, but they weren't reporting it. So that number could be higher. Patients with vitiligo sometimes report feeling immobile by the psychological aspect of their disease. Thus, they will limit their lives, and so they don't reach their full potential. So from his study, there were numerous studies that have discussed the ways in which the mind can affect the skin. And so he looked at those numerous studies. And one thing he reported is that the skin and central nervous system share embryonic origins. And there are inherent organic connections between the psyche and the skin. For example, when we are embarrassed, we'll blush and our cheeks will get pink. So, one model for explaining how this interrelationship works suggests that individuals inherit basically a predisposition to certain diseases or disorders, and those will remain dormant and only appear when they're triggered by a specific psychological or biological event. Psychological factors might trigger the disease. It is thought that vitiligo occurs as a function of autoimmune deficiencies, and we've known from studies that serotonin metabolites can directly influence the depigmentation of the skin. So we know that serotonin and like stress levels can really influence how people's autoimmune diseases are working. So that can be applied same to vitiligo and basically the depigmentation of the skin. So psychologists have known actually that autoimmune disease and endocrine systems are impaired in patients with anxiety and depression, and that serotonin plays a critical role in depression and depression-related symptomatology. This data was also used in another study, Paradopoulos, in which they showed the onset of vitiligo was triggered by a life event, such as like death or possibly moving and resulting in other types of losses. And the results in this research study showed that patients with vitiligo experience a significant number of stressful life events in the year preceding the onset of their vitiligo. 40% reported a death of a close friend or relative in their prior year, and 25% reported relocation. So the change of a life event like loss of friend, family, or familiar surroundings. What I take from this study and how it can help us is just the importance of med-FTs intervening and helping us lower people's stress, helping them with their depression, with their anxiety, and all of that is going to in turn help them with their prognosis of the disease. And so if stress can trigger maybe an outbreak of vitiligo, if we can keep them their stress low and keep them keep their depression basically gone, then we can definitely help them to avoid having this spontaneous outburst of the depigmented skin. And of course, since being a marriage and family therapist, I have to think of the systems and think of the effects that it also has on the family. And so I found this awesome article through the library, and it's called Hidden Victims of Childhood Vitiligo, Impact on Parents' Mental Health and Quality of Life. So what they did is they took parents with children between the ages of 3 and 18 years of age and who had been diagnosed with vitiligo, and they gave them 2 questionnaires. The results basically showed that parents with children with stable vitiligo tended to be more affected than those with children with vitiligo, with progressive vitiligo, with regard to helping with treatment. It also showed that parents with children with vitiligo tended to be affected a great deal in terms of psychosocial and social health. And this was, of course, more pronounced in moms who tend to be the primary caregiver. The parents are often mentally and physically fatigued. It did mention that they didn't really have a lot of lack of sleep, and I think that's because vitiligo isn't something that is painful, it doesn't hurt, and so therefore it shouldn't interfere with someone's sleep pattern compared to other diseases that would definitely do that. It did report that a lot of the time the parents tended to put a lot of blame on themselves for this disorder, or they would blame their emotions, and of course they'd be very focused on their children's care and treatment. It'd be interesting to know how this affected the whole family, siblings as well as just the parents. So just looking at the social part of vitiligo, we've talked about how some have had job discrimination already. We've talked about other social aspects when we're talking about the psychological part. But we do know that vitiligo doesn't cause any physical discomfort to the individuals that have it, but it does lead to social antagonism. So as we talked about previously, patients who do have large family support are more likely to adhere to medical treatment. I think a lot of that has to do with them maybe supporting them in the commute there and asking them about it, asking them questions about it, just kind of making it a part of their daily routine and life. I know that's something we've done with Caden, is that he wears sunscreen every day, summer or winter, and it's just something that he's used to now. It's like his lotion that he puts on every morning. That's a part of his daily life. Also, patients with family who are more supportive tend to be less depressed. And so this is also going to help in their disease condition, as we heard about in the previous article. Many patients talked about socially isolating themselves from public due to the embarrassment of their diseases, leading to psychological disorders. One thing that one of the articles mentioned was that people in public would actually come up to them and ask them questions. One question that I believe was actually quoted was that, do you have those spots in your private areas too? And so that can be very, that can just have a lot of stigma placed on it when you're in public and people are asking you those types of questions, and especially if you don't want to answer them. So that can, of course, cause them to want to not go into public to avoid those situations. And I can honestly, from self-report, I haven't had many experiences with people asking Caden about his vitiligo, but we were at Walmart once, and a guy that was checking us out asked him, what are those spots on your neck? And most of his are pretty hidden because he doesn't have them on his face or hands yet. But I just still found it crazy that this person was just asking what was wrong with him that we didn't even know. And so, I do know that happens to people, and I'm sure the more spots they have, the more questions they get asked. Many reported having sexual difficulties, so they didn't want to expose their skin to their lover during sexual encounters, and so that was really hard for them. And they were always worrying about, like, if they were looking at those spots instead of being able to just let go and be in the moment. And then many limit themselves so that they don't have to go out into the sun, so that they can avoid exposure, so they just don't even try to do certain things. Something that's interesting that some of you may know, I didn't know this before Caden was diagnosed, is that Michael Jackson actually had vitiligo. And society kept saying that he was wanting to be white, and he was wanting to bleach his skin and those things so that he would fit in. But that wasn't the case. He actually had vitiligo, and he was just wanting all of his skin to blend, and he was a darker race, and that was hard for him due to the fact that it showed a lot more, and he was in the public eye. And so something that I did read while I was researching this is that his doctor treated him in a different way. He didn't try to get his skin to be repigmented. Instead, he tried to depigment all of his other skin. So that's why he got so pale. And the reason for that is because he had it so bad and it was all over that was the best course of treatment for him. And so we can definitely see where society plays and social aspects has a big role on the individual. I also read an article that talked about individuals in India. And this article, the disease is associated with many religious beliefs, and the patients are outcasted from the family and the society. And this causes the patient and the family to go behind rituals rather than seeking medical help. So they kind of basically refuse the medical help because they have to go along with their religious beliefs and things like that. And so we can definitely see where different cultures have different beliefs as far as the treatment goes, and also have different stigmas placed on them socially, and maybe more different psychological problems just due to the color of their skin and their religious beliefs. So that's basically all I have about vitiligo today. Thank you.